Welcome, everybody. It's good to see everyone.
Good to see you too.
Hey there.
Good afternoon, everybody.
Does anybody have any specific questions that they wanted to talk through?
I've got a wacky one. I'm not gonna say any names or locations or anything because I came across an uncomfortable situation this week where I was in a um, medical provider's office, and it it was a HIPAA. I was presented with a HIPAA statement dated 2012. Right? A little awkward, missing some key legislation, including things like breach notification. And so I went up to the desk and I said, "Do you have something more updated?" I said, this is out of date. I said it doesn't actually include recent legislation. I was very quiet about it because most people don't know, they don't care, and the providers have a window where they can correct, right? But then they
14
they
years?
provided 14
14
years,
years?
14 years. And then somebody went in the back room because that was a laminated one, right? I could read it, but I couldn't take it. So then they went in the back room and printed off the same thing, removed the date, and handed that to me. So now I have an updated HIPAA, and their intake process included a paper form, which required a full social security number. It gets better. Like it just kept getting better. So it was ultimately a situation which did not progress. I kept quiet. I handed back the undated one and I said, "You shouldn't give this to anybody. But you shouldn't distribute this." I said, you need to, have this refreshed very quickly. But in my mind, I mean, the people at the desk had no idea. So one, this is like a red flag. Training is not happening. People don't understand what this is in the first instance. Somebody doesn't know that 14 years out of date with no updates is inappropriate. If this is what the public facing information looks like, what does the back end security actually look like?
Right.
And then you get the paper form, which is requiring a full social security number. And where's that going? And how is that destroyed when it's done? And, so I pointed this out. And then their correction was um, the medical provider doesn't feel comfortable at this point. They're not going to conduct the appointment.
Wow. So
Which
you're
shows
like, okay,
the
here's my business card.
non-retaliation they have in their own statement. And I said, okay. And they said, "Would you like to reschedule?" And I said, "No, I would not."
No, here's my business card. Call me when you realize all the things
Uh-huh.
that went wrong here.
Yes. But this was flooring on so many levels
Oh,
and
sure.
really concerning because all it takes is for one person who has, you know, maybe a shady character and a few good connections to walk into their office, understand exactly what their setup is, and exploit it.
Hmm.
That's all it takes. So here's a notification to all the small office medical providers out there. If you have an outdated HIPAA that you're giving out to patients, stop that immediately and update it. Make sure your office has HIPAA training, everyone. And make sure your security is up to date. There have been very substantial legislative updates, including like breach notifications since 2012, and you need to include that. Also, if you're using the same paper form for intake that you used in the 1990s, stop that. Please stop that.
Well, and I wonder, who would be the enforcement to make sure that these small practices are doing that? The only thing I could think of is that the insurance companies, the payers, would have to insist on some level of, kind of how it's like, well, we're we're trusting you as a business partner. So I would wonder if they would be able to be that kind of that enforcement arm to say, okay, you at least need to
Mm.
get HIPAA training, because I know like fraud, waste, and abuse training, if you're taking any kind of Medicare or Medicaid patients, has to happen every year, everybody, no matter what. And I just
Yep.
wonder, maybe they've stopped taking insurance because I can't imagine that, a Blue Cross Blue Shield would be like, yeah, sure, treat Social
This
Security numbers and
provider
patient
was
data like
accepting
that.
insurance.
Yeah.
They were accepting insurance. Yeah.
Wow.
Yeah. So it feels like to me, and I would love feedback on this,
Yeah.
that the right points of contact would be HHS, OCR,
Yeah.
on the federal level. It would be the state, whoever, whatever the state commission, the state level commission is for data privacy. And
THSA here in Texas.
okay. And then on the third level, whatever the board is that governs that particular area of practice, that particular area of medical practice. And I say that because, you have um, GPs, you have specialist office, you have folks like dentists and optometrists, and these areas fall into different boards sometimes. So those boards are also responsible for professionals in their in their network.
Mhm.
um, but I'd welcome feedback on that, because who does govern it?
Well, I think you've got it from the right perspective, from the government perspective, but I also would go to your insurance provider and say, if
Mhm.
this was an in-network provider, what kind of parameters are you using for your network? I mean, there's got to be some sort of standard, and it can't just be price. I would hope it's not just price, that it would be
Mhm.
qualifications. Somebody's got to make sure that these people are credentialed and,
Mhm.
that they haven't lost their license for something if they're
Yeah.
being, if they're accepting insurance. And you think very similarly, they would have, at least a question or two about what are your HIPAA practices about
Mhm.
keeping patient information safe.
Yeah.
So,
But it's very frustrating, because in some cases it feels like these are very big bats for a smaller correctable situation.
mhm,
You know, I would say, and I'm not saying they should be ignorant to the law, but medical providers, to my understanding, they don't have specialized training in things like data privacy. They're supposed to, but who tells them? Who enforces that? Who
Right.
makes sure that they're getting the appropriate training they need to actually run a practice?
yeah. And I've seen posts like on LinkedIn about that, especially like dental service organizations, that dental schools are producing dentists that don't have a clue how to run a business. And so
Yeah.
they don't
Uh,
know what those regulations are. And
I think part of that though comes back to, and specifically on medical and dental and those types of fields, is a lot of them don't realize, much like running a law practice or a medical practice, half your time isn't running clients, it's running the business.
mhm,
And I think there's a big educational piece there where people need to understand, unless you get picked up by either a firm or a hospital or a provider in some way, you're going to have to go out and beat the streets and make money.
Mhm.
And you know, I think a lot of people miss that when they're, because I know a lot of medical professionals, and they're in it for the right reasons, right? They want to
mhm.
help people, and it's a lot of education, it's a lot of training, and adding that additional burden on top of it, often overwhelms a lot of people. You know,
Yeah. Well, I mean,
you
I
need
would
great
see
doc.
more hiring an office manager that
Yeah,
had
yeah,
that
no,
that
it's
business acumen to know how to be that operational officer for your
yeah,
business
yeah,
so that you could
yeah,
focus on patient care, treatments and things like that. But yeah, there's definitely not, I don't think there's a standard for any of
Yeah.
that. And
yeah.
that definitely is lacking.
But I feel like a lot of the office management ends up with folks who are, um, I'm sorry, there are official titles, but somebody who's like a medical, a professional
Okay.
medical assistant knows how to do intake and paperwork and that sort of thing. And it ends up falling to them. And while they have a lot of experience typically with how to liaise with insurance companies and codes for things and how to kind of classify different things and organize a doctor's schedule effectively. I'm not sure that they've got all the training on compliance.
Mhm.
How to look, before you buy a new system for the practice, is it meeting the regulations you need? Is
Yeah.
it secure? I mean, health tech these days, you can go out and get all sorts of fancy stuff.
Yeah.
But those tires are not kicked.
Mhm.
They don't have even a SOC 2 in a lot of cases. They've just spun up a system and they've solved a problem, but the security is a secondary thought at best.
Yeah.
No, I agree.
Yeah,
I agree.
and it may
Yeah,
maybe tie it into an HRIS system or something like that, where there's a component of that that
Mm,
says, okay, in addition to making sure your I-9s and all of the identity of bringing on a new employee is aligned, that you also, oh, you're in the medical field, you also
mhm,
have these ways of bringing on a new patient, and
mhm.
here are the different things that you need to do.
Yeah. And this is where I wish more of the universities would offer things like compliance certification,
Hmm.
compliance certificates or additional training, because they could be used in so many different ways. Not
Yeah.
only, when you're a CISO or and you're trying to figure out which framework is best for my organization, and trying to make informed decisions, and you've got a whole lot of people marketing different things, but what you actually need, is a bit of brass tacks logistics,
Yeah.
and back end information. It goes to the same, you mentioned earlier that they don't teach the business stuff in dental school. When I did my MBA, one of the women in my course was a surgeon. And I had teased her at the time. I said, with respect, I said, I feel like your degree outranks this one. I said, so why are you here? Why do you want an MBA? And she said, very pragmatically, she said, I'm getting up into the management level at the hospital, and they don't train you for this in medical school. There is no training. They don't tell you how to deal with personnel issues and management structures and, the fiscal side of things. That's not part of that school. And so it was an eye opener for me, and it made sense when she explained it. But it was, I mean, I had to laugh at first because I'm like,
Yeah.
a surgeon wants an MBA? Like it
Mhm.
just, you
Well,
know,
and it's funny because I was talking about HRIS systems. There are EMR systems that do that, and so you can, buy yourself a system and have, be a tenant in that system that would have patient consent, electronic signatures,
sure.
treatment plans, everything is there and done. And I just wonder, like, for this, I probably would have gone back, or maybe even, called into the office manager later on and go, well, what system do you use to hold patient information? Because there's probably a module that they just don't know about that would actually give them that HIPAA compliance, with the right dates and the more, they just probably have an old process and they probably have a solution at hand that they just don't know
Mhm.
about. And it
Right.
would be somebody going for 4 hours of training and somebody else that, then coming back and telling everybody, okay, well, instead of doing it this old way, our system now has that.
Yeah. Yeah, no, that makes sense. Although I would also, you know, if they're at all switched on about security, they probably shouldn't be sharing what electronic health record system they
System
use
they're using. Yeah.
to somebody outside the business or the practice in any case, because it
Yeah.
just gives them
That's true. Yeah.
leg
I
up
mean,
on how to hack you.
yeah. But you're kind of like, for somebody that's going to want my social security number written down on a piece of paper that I don't know
I
goes where, you're like,
agree.
hey, trust
Agree.
is a two-way street.
Uh, I, it's
Point taken.
it's interesting because I've had folks. So I'm on the military retirement medical, so I don't have to give my social. I have a DoD benefits number, and it's interesting to see how many providers don't understand why I won't give them my social. I'm like, if this coverage is in lieu of anything you'd find, and
Mhm.
you know, I'm like, well, what if we have to bill you? I said, then you have my contact information, but there's no way I'm, you know, There's no way I'm gonna provide my full social for something like that.
Hmm.
And I have multiple different identification cards that can be used to verify who I
Mhm.
am.
Yeah.
Yeah, that was a question I had gotten back in the 90s. I think I had gone for one of those, free uh, medical screenings, and
Oh
they
yeah,
wanted, and it was employer sponsored,
Mhm.
but sitting in this little RV in the back parking lot, and they were like, okay, before we take your blood pressure, what's your social? And I'm like, wait, what? And I was like, why do you need my social to take my blood pressure for free? And they were like, well, just in case we have another patient with your name. And I'm like, you don't have another patient with my name and address and phone number. It's
yeah,
like that
yeah,
that is enough to uniquely identify me. I
Hmm.
guarantee you there is no other Susan Richards living in my house. So
yeah.
you have
Hmm.
what you need. And they were insistent. They were like, well, you can't go through the screening. And I was like, okay, well, 555 112 1212. Like,
It's
very
yeah.
fake. You know it. I know it. It doesn't matter. So that was
And
bizarre.
it's a little crazy. Um, yeah. Anyways, learning curve still out there. Mhm. In
It
case
is.
anybody
It
thought
is.
we
Well,
were closer.
well,
So
Donna, I found your story very interesting from multiple perspectives, right? And at the end of the day, you weren't hired, or you may be hired, but you weren't hired, so you don't really have obligations to report. But I mean, it would
But
be
as a
unnerving.
patient, yeah, as a prospective patient, I think you would
I've
because,
I've
yeah.
walked out of providers before because I was uncomfortable with their setup.
Yeah.
Now, in their defense, okay, in my defense, I don't know. I'm defending somebody, but anyway, to explain the situation, I did speak to them before I walked out of the appointment, and I said, "Look, here's the reason. This is what I do for a living. This is what I see in your system, and I'm not comfortable having my information in that." I said, "More than happy to address at a later point. I can give you some locations where you can get some free resources." I said, "But I'm not going to continue with this."
Mhm.
Um, but I definitely always, like Donna did, I always let them know, like, look, this is an issue. You should at least look into figuring out how to address it.
Yeah. Yeah. And that's what, I had been prepared to fill out the intake form and just say, I didn't receive the HIPAA. And that was an unacceptable solution to
Hmm.
them.
Yeah.
And I understand that they need to hand it out, but they need to hand out a legal version.
Correct. Yeah, the correct version of it.
Well,
Feels like,
it,
chicken and the egg here.
we
But yeah.
we used to get people who would try to copy military ID cards, and it's not allowed. And I can't tell you how many times people have been like, "Well, we can't give you service without a copy of your identification." I said, "Okay, you got a driver's license. That can be copied, but you're not supposed to copy a DoD form."
That's
Yep. Yeah, because I mean, who knows what their consent form could have just said, HIPAA is good. And you're like, yep, okay, I got it. It's not legal, but
Yay,
yay.
HIPAA!
Yeah, exactly.
well, and that's what it felt like the last form basically was because they were just printing out the same thing that I'd already seen, and had said, that's
Let's
it's
just white out yeah. Just white out the
2012,
Yeah,
date.
and I
I,
can't do
I,
President write in the new date, today's date or something.
I, I'm not going to say the particular show, but there's three emergency services in a particular city, and
it.
if you look up shorts from that particular hospital show, they have some really interesting patient privacy, patient right, HIPAA situations. If you do a Google search on YouTube, I may grab a couple of them and grab them for next week. But it was interesting because one of the things, like, not so much privacy, but in this case, patient consent. Um, you know, provider was arrested for not allowing the the police to take blood, and the person was not able to give consent, so they couldn't legally do it. They arrested the nurse who wouldn't let them take blood, and it was for a drug or DUI charge. But it brings up some interesting questions, specifically on the medical side, about you know where does the patient and provider rights step into Fourth Amendment rights and things like that.
Yeah, yeah, it does. And it's hard because it does feel, in some cases, I feel like, people would look and say, gosh, that was an overreaction. But was it? Because I just had a credit
Uh,
card fraud situation. So,
February,
social
February. Okay,
security,
February.
and where are you going with it?
Yeah, I had to reset everything in February.
Hmm.
Um, I know where it happened. Um, nothing I can do about it, but I know where it happened.
Yeah.
Um, but yeah, it's and I always used to joke when I was teaching the class, it's like, that one of the reasons that I'm very passionate about this particular field is it used to become a running joke that you'd get the letter from your healthcare provider once a year when you were in the military that someone had left their laptop in the back of the car at the bar and the laptop was stolen. And I'm like, go to a different bar. Like seriously, go to a different bar, get a different car, right? Put it in the passenger seat, you know it was almost cookie cutter because like we'd get the breach notifications from the providers. I probably have 25 of them in my time in the military. And it's one of the reasons that, like Donna said, it happens to us that makes me this passionate about some of these things.
Hmm.
But
Yeah.
but Dennis, if the data is encrypted at rest, then it's not a breach, right?
Exactly.
It depends on whose definition of breach you use.
Okay.
I want to know how they're encrypting the paper.
Exactly. Exactly.
Uh, anyways,
All right.
so that
Fun
was an
conversation.
anecdotal story for the week.
Yep.
Fun
Yeah.
conversation. Yeah.
Yep, absolutely. All right. Well, it was great seeing everybody. We'll
Yeah,
It was
wrap up
great
if
absolutely.
nobody
seeing
has
everybody.
anything else. All right. We'll see you next
Right.
week.
Thanks.
See you next.
Thanks for watching. Please like and subscribe to HITRUST Secrets.